Chemotherapy is a common treatment option for many types of cancer, including intestinal mesothelioma. However, chemotherapy drugs are strong medications that affect both cancer cells and healthy cells. This can lead to a variety of potential side effects. The specific side effects experienced will depend on the individual, their health history, the exact drugs used, dosage amounts, treatment schedule and other factors. In general, though, some of the most common side effects of chemotherapy for intestinal mesothelioma include fatigue. Chemotherapy can cause extreme tiredness and fatigue. This is one of the most frequently reported side effects. Fatigue may start during treatment or soon after and can last for several weeks. Some people have to plan their day around periods of rest. Extra sleep is usually needed. Nausea and vomiting. Chemotherapy often causes nausea and vomiting. The risk and severity varies depending on the specific chemo drugs, dosage and individual. Anti-nausea medications help control these side effects for many, but not always completely. Nausea and vomiting may occur within hours of treatment or up to several days later. Diarrhea. Some chemotherapy drugs can irritate and damage the lining of the gastrointestinal tract, including the intestines. This increases the risk of side effects like diarrhea. Diarrhea during or after treatment may range from loose stools to severe, watery stools several times a day. Anti-diarrheal medications and dietary changes can help manage diarrhea for some patients. Loss of appetite. When the gastrointestinal tract is irritated by chemo, it often leads to a loss of appetite or taste changes that decrease food enjoyment. This in turn can result in unintentional weight loss if not addressed. Eating small, frequent meals and meals high in calories and protein may help boost appetite and nutritional intake. Foods that appeal to the patient should be encouraged. Some nutritional supplements may also help. Hair loss. Chemotherapy often causes hair loss all over the body, including the head. Some patients just experience thinning hair while others lose it all in clumps. Hair loss usually starts within 1 to 3 weeks of treatment and new hair growth begins around 6 weeks after treatment ends for those who experience it. Hair regrowth varies in appearance for some compared to pre-treatment. Cold caps worn during chemo may help preservation for some. Mouth sores. Chemotherapy can damage the mucous membranes of the mouth, leading to mouth, oral lesions and sores that cause pain and make eating difficult. Oral hygiene is crucial to prevent infection. There are rinses, lozenges and pain medication available to help manage mouth issues during treatment. Dental checkups are also important for oral health support during chemo. Skin issues. Dermatologic side effects from chemo are common and include rashes, itching, dryness and discoloration. Sun exposure should be limited due to increased risk of sun sensitivity. Moisturizers help manage dry skin issues. Inform healthcare providers promptly about any problems or changes in the appearance of skin or nails. Nail changes. Some chemo damage the nail beds, causing nail discoloration, brittleness, crumbling or thinning, called onycholysis. Nails may dislodge or pain may occur. The recovery time can be lengthy, sometimes up to a year or more. Nail damage is usually only a cosmetic issue but close monitoring for infection is warranted if there are open nail beds. Changes in menstrual periods. Chemotherapy can induce early menopause and menopausal symptoms in some premenopausal women. This is a potential long-term impact of treatment that may require hormone replacement therapy, HRT. Menstrual periods may become irregular or stop completely during and after chemo depending on the woman's age. Infection risks. Chemotherapy suppresses the immune system, making patients more susceptible to infections that are normally fought off without issue. Avoiding sick people, staying up to date on vaccines and promptly informing healthcare providers of any fever or signs of infection are important safeguards. Antibiotics must be taken as directed. Blood cell reductions. Many chemo drugs act by killing rapidly dividing cells, such as blood cells. This can lead to low blood cell counts like low red blood cells, anemia, low platelets, thrombocytopenia, or low white blood cells, neutropenia. Blood work is closely monitored and transfusions or growth factors may be needed. Patients should avoid anything potentially unsafe while blood counts are low to prevent infections. Nervous system effects. Some chemotherapy drugs are neurotoxic and may cause nerve pain, neuropathy, headaches, dizziness, cognitive difficulties concentrating or remembering, sometimes called chemo brain. Nerve pain and numbness, tingling in hands or feet often improve slowly after treatment but can persist long-term for some. Secondary cancers. Certain chemotherapy agents come with an increased risk of secondary cancers later on due to their mechanism of action and potential for cumulative damage over the years. Regular cancer screening follow-up guidelines are important post-treatment. However, the risks are usually low and must be balanced against the need to treat the initial cancer. Cardiotoxicity. Some chemotherapy drugs are cardiotoxic and may cause short-term or long-term damage to the heart. This potential risk must also be weighed against treating the cancer. Those with pre-existing heart conditions may face higher risks of cardiac issues from chemotherapy. Cardiac monitoring is usually implemented. Chemotherapy is an effective treatment for many cancers but also places significant demands on the body. Intensive medical care and supportive treatments are required to manage the sometimes severe side effects. Every effort should be made to prevent, promptly identify and properly treat side effects from chemotherapy, as doing so optimizes treatment outcomes and quality of life for intestinal mesothelioma patients undergoing this intensive treatment. Patients must be educated on the potential risks and know when to report new or worsening issues. Close communication between the cancer care team and individual is paramount. With diligent care, many patients are able to complete their chemotherapy course as planned if given the